So this was my first kind of workshop of this kind, and so I'm working with the youth committee with the Our Youth, Our Response project, and I'm aware, I'd say more aware than the average person, of what's going on in HIV, hepatitis C outreach in the community, but definitely learned a lot more about what's available, the services that are provided across the Atlantic region, and just the role that these community organizations play in the Atlantic region. So I think that was one of the biggest things that I learned and can take away and pass on to my networks, etc. In terms of, because we're doing head, heart, and hands, so in terms of heart, I definitely have this feeling of the community in general, and maybe people who aren't as affiliated with this kind of thing, not the frontline people, not the people that know or don't know or that kind of thing. So kind of the role of maybe myself and these kind of groups in just letting the public know what's going on and what's available to them and what's going on in their community. So I have a bit of a feeling of that. And practically, I guess, just kind of continue to engage in the youth committee and continue to try and get others involved and interested in these kind of things and make them understand that they can relate to such things even if they don't think they can.
So my name is Laura Toole. I'm the Support Services Coordinator with the AIDS Coalition of Nova Scotia. I've enjoyed my time here with the workshop over the past few days, and I'm going to reflect on what I have learned, and that's fun ways to engage youth. So we've learned about beer goggles, for example, which was an awesome strategy in working with youth, and also meeting them where they're at and the importance of engaging youth in policies and programs. In regards to my hands, what tangible actions I'm going to partake in after this event, I'm going to continue to build our community relationships and to maintain them over time and continue to meet with community partners formally and informally. And it was really nice to be in a room of like-minded people who are fighting constantly stigma and discrimination and are working because we care about our clients and populations at risk.
What I learned in terms of my head would be that evaluation is significantly more difficult than just looking at numbers and stats. It needs to be more complex. My takeaway is going to be trying to develop a subcommittee that will help our organization be informed by youth, and so that subcommittee hopefully will be youth-driven, youth-led, that will report to our board on what's happening within the youth community. And in terms of our heart, my heart, I look at this in regards to education. This is not just about a virus, but this is about protecting our youth future as well as our own future.
My name is Jeannine McNeil, and I work at the Public Health Agency of Canada. And I filled out the head, heart, hands, but I actually didn't put anything under hands. But for head, I learned a lot about new projects today. I always find at meetings like this, I always learn something new, so that was great. But probably the biggest one for me today was under heart. I'm thinking a lot about language and rethinking some of the language we use. And it particularly struck me when Jessica spoke about the term youth at risk and how youth aren't at risk on their own and what that term might mean used in isolation. So that's a term I'm definitely going to reconsider using in the future. Thank you.
Hi, my name is Jackie Gahagan. In terms of the head, heart, hands, head was really sort of imagining what the next generation of HIV, hepatitis C prevention for youth will look like, particularly when we think of hepatitis C and HIV traditionally as sort of standalone issues. How can we do what we do better? And so that was kind of a heady thought. In terms of heart, it was really reassuring to see the energy and the commitment from folks in the room, and so that was certainly something that was quite quite... Alex, keep it down. I will use your last name, Alex, if you keep giggling. Pay attention. And then hands, in terms of the way forward. And there were some concrete ways to move the integrated agenda forward, which is basically doing better at keeping our networks alive and connected and making sure that we do our part in remaining connected to our networks. That would be my hands piece. Thank you for your time.
Hello, Sarah Peddle, reporting live about heart, hands, head. I did it backwards, but I'm different, so. I think what I take away for head is that there's lots that I don't know. And this was an opportunity to learn from a lot of people from all different sectors, and also to hear from youth themselves, because they're often people that we talk about, how do we engage youth and what do we need to know about youth, and different models of practice that are actually going to be informed by the voices of youth. And I think that's really important and integral to the work that we're doing. In terms of hands, I don't know. Practical actions. Well, I guess because I work with a network, the practical applications for myself is just expanding the network and actually working in different ways. And this actually creates an opportunity to form a number of working groups on the action items that came from 2 days of discussion. So there's already buy-in to some of these ideas, and we can have significant impact in the Atlantic region on engaging youth and on hepatitis C and HIV, harm reduction, and addictions. So I think tackling all of that in 2 days is pretty phenomenal. So I would say that also speaks to my heart, because the reason why I do this work is because this is work that has meaning. This is work that is often thankless, but when you have a group of passionate people like this in one room, you really leave feeling like there is hope and that there's something that we can all do together. So I'm leaving here feeling really inspired, so thank you.